All right, today we're diving deep into a real workhorse of heart medicine, a drug called Diltiazem. You might have heard the name, but trust me, the story of how it works is this incredible peek into the amazing machinery inside our own bodies.
And yeah, this is the big question, isn't it? It's a bit of a puzzle. How can one single pill do two things that sound kind of different? On one hand, it's relaxing your blood vessels to bring down blood pressure, and on the other, it's telling your heart to just slow down a bit. The answer is on a microscopic level, and that's exactly what we're going to unpack together.
So, first things first, what is Diltiazem? Well, the easiest way to picture it is as a very, very specific gatekeeper for your heart and blood vessels. It's a gatekeeper that controls one tiny but super powerful little thing.
Okay, let's get the technical term out of the way. Formally, it's a non-dihydropyridine calcium channel blocker. Whoa, that's a mouthful, I know. But that first part is really the key. All it means is that unlike some other drugs, it's got this nice, balanced effect on both your blood vessels and your heart. You probably know it by brand names, maybe Cardizem or Tiazac. Its whole job is to help out when the heart and vessels are working a little too hard.
But to really get how a calcium channel blocker works, you first have to appreciate just how important calcium is. I mean, in the cardiovascular system, you can basically think of calcium as the body's universal on switch. Seriously, calcium is at the center of everything. When calcium ions rush into the muscle cells of your arteries, those arteries tighten up and your blood pressure goes up. It's the trigger for that powerful lub-dub squeeze of your heart. And, this is a big one, it's what carries the electrical signals that tell your heart how fast to beat. It is literally the spark that makes the whole engine go.
So if calcium is the on switch, Diltiazem is more like a dimmer switch. See, it doesn't just cut the power completely. No, instead, it just gently dials things back. It controls how much of that on signal gets through by literally blocking the gates the calcium uses to get into the cells.
And here's exactly how it does it. It targets these specific little doorways called L-type calcium channels. You can just imagine it standing right in the doorway, acting like a bouncer. By blocking the entrance, it limits that flood of calcium trying to rush into the cells of your heart and blood vessels. And the effect is almost immediate. Less calcium means less squeezing and a slower, calmer electrical signal.
And this brings us right back to our original puzzle. Here's that dual action in plain sight. For the blood vessels, blocking calcium makes them relax and get wider. That's called vasodilation. And boom, that lowers your blood pressure. At the exact same time, over in the heart, it's slowing down those electrical signals and easing up on the force of each beat. The heart doesn't have to work so hard. It's this beautiful two-for-one deal that makes the drug so useful.
So let's just trace that one more time, nice and simple. Step 1, Diltiazem blocks the gates. Step 2, because of that, less calcium gets inside the cells. Step 3, the result is that the muscles chill out and the heart's electrical pace slows down. It's a really clear, direct cause and effect. Okay, so that's the cool science. But how does this all translate into real life? I mean, why would a doctor actually prescribe this stuff? Well, it's all about connecting that tiny action inside the cell to a big positive outcome for your health. The number one reason is for hypertension, high blood pressure. This one's pretty straightforward. Remember how it makes the blood vessels wider? Well, that just gives the blood more room to flow, which lowers the overall pressure in the system. It basically makes it way easier for your heart to do its job.
Next up is angina, or chest pain, and this is where the drug is really clever. It helps in two ways at once. First, it widens the arteries that feed the heart muscle itself, getting more oxygen-rich blood to the heart. Second, by slowing the heart down and lowering blood pressure, it reduces how much oxygen the heart needs in the first place. It tackles the problem from both sides, boosting the supply while cutting the demand. Just brilliant.
And then for rhythm problems like atrial fibrillation or AFib, Diltiazem plays the role of a traffic cop. See, in AFib, the top part of the heart is sending out all these chaotic electrical signals. Diltiazem doesn't stop the chaos, but it stands at a critical intersection, the AV node, and only lets a reasonable number of signals get through to the bottom chambers. This keeps the heart from beating dangerously fast. It's a rate controller, not a rhythm fixer.
All right, now with any medication this powerful, knowing how to use it safely is just as critical as knowing how it works. So let's go through the must-know safety checklist.
There are definitely times when this drug is a no-go. And it makes perfect sense, right? Since its whole job is to lower blood pressure and slow the heart's electrical system, you would not want to give it to someone who already has super low blood pressure or someone with certain conditions where the heart's wiring is already too slow, unless, that is, they have a pacemaker to act as a backup.
Okay, what about side effects? A lot of the common ones are predictable. That feeling of dizziness or warmth, that's just those blood vessels widening. Swelling in the ankles is another classic one. But you have to know the difference between those and the serious ones. If your heart rate gets way too slow or your blood pressure drops too low, that's not something you wait on. That's a red flag that needs a call to your doctor pronto.
Now this is huge. Diltiazem is handled by a certain crew of enzymes in your liver. The thing is, it can kind of hog their attention, which means other drugs you're taking might not get processed properly. For instance, if you take it with a beta blocker, which also slows the heart, you can get a double whammy effect that's pretty dangerous. It can also cause levels of some statins to build up, raising other risks, and that is exactly why your doctor and pharmacist need to know every single thing you're taking. No exceptions. So finally, let's wrap up with the key rules for anyone on this medication. First, a lot of these pills are extended release. They're designed like a time capsule. If you crush or chew them, you get the entire day's dose in one massive, dangerous hit. So don't do it. Second, don't just stop taking it suddenly. That can cause your blood pressure or chest pain to come roaring back. And lastly, make it your mission to tell every single doctor, dentist, and pharmacist that you're on Diltiazem. It helps keep you safe.
You know, in the end, it really all comes down to this one crucial idea. Diltiazem is a fantastic, incredibly useful tool, but it's a tool that demands precision. There's a quote that just says it all perfectly. Its success really hinges on appropriate patient selection, careful dose titration, and vigilant monitoring. It's all about using the power of that gatekeeper to protect the heart in exactly the right way.